Hello anatomy classes. Here is another video to go over the muscles of the head, neck, and eye. There are 21 muscles that will be covered in this video. The first muscle under our neck muscles is the Sternocleidomastoid muscle. And I'm going to highlight it with my magenta pen. And the white arrow is also pointing to it. Of course, there is one on the right and the left. And the sternocleidomastoid muscle is named because of its origins and insertions. It has two origins, the manubrium of the sternum, and you can kind of see this down here, and the clavicle. You definitely can see it here. It inserts on the mastoid process. Its action is to rotate the head and flex the head. If the two sternocleidomastoid muscles work together, if you're flexing them both at the same time, you will flex your head. You will look down at your chest, for example. But they can be used individually. And that is going to lead to the action where it's rotated. Remember that when a muscle contracts, it pulls the insertion towards the origin. So that means if you're turning your head to look left, you're actually using your right sternocleidomastoid muscle, because the right muscle is pulling on that mastoid process and pulling it towards the manubrium and the clavicle. If you turn your head to look right, you're actually using your left sternocleidomastoid muscle. And if you do those actions, you can actually feel that muscle contracting. So as usual, when I make these videos, there are 2 slides for every muscle. On the first slide, I have a picture and I highlight it. And on the second slide, I have the origin, insertion, and action. And if you print these in a certain way, you can actually have them print as flashcards, or you can print them and then tape them to flashcards. So that's why I have them that way. And sometimes I have alternate pictures that are included on both slides. Our next muscle is the Sternohyoid, and like the sternocleidomastoid muscle, it's named because of its origin and insertion. Its origin is the manubrium and clavicle, and it inserts on the hyoid bone. So again, Sternohyoid. Up here, you can see the hyoid bone. And this muscle that I'm outlining right now is the Sternohyoid. It's partially covered by the sternocleidomastoid muscle. So that's the Sternohyoid. Let me move this arrow to actually point to that. Now we're pointing to the Sternohyoid. And the action of the Sternohyoid is to depress the hyoid bone and larynx. Now we're going to move on to the Sternothyroid. And I'm going to copy this arrow and use it on the next slide. So again, the Sternohyoid, the origin is the manubrium and clavicle. Here we can see the hyoid bone again. And here is the Sternohyoid. It's just another perspective of it. It inserts on the hyoid bone and it depresses the hyoid and larynx. As I said, our next muscle is the Sternothyroid. Its origin is the manubrium. It's going to insert on the thyroid cartilage. Again, it's named for its origin and insertion. Sternothyroid. Let me just use my white arrow again to point to it. The sternothyroid is deep to the sternohyoid. you can see just a piece of it sticking out here, and I'm trying to point with my white arrow here. So let me move that over to the side and highlight the sternothyroid. Again, the origin is on the manubrium. It inserts on the thyroid cartilage. You can see a portion of the thyroid cartilage here. And its action is to depress the hyoid and larynx. So again, let me bring my white arrow back and point to that. Origin, again, manubrium, inserts on the thyroid cartilage and depresses the hyoid and larynx. Now we're to the mylohyoid. The mylohyoid is going to have its origin on the mandible. It's going to insert on the hyoid bone. Its action is to elevate the hyoid. Now, the mylohyoid muscle is seen here deep to the digastric muscle. The digastric muscle is going to be addressed in just a moment. The mylohyoid muscle fibers go in a horizontal fashion. So we can see a portion of the mylohyoid here and here. And the fascicles, like I said, are going in a horizontal fashion. The muscle that is over the top of the mylohyoid is the digastric, and I'm coloring the digastric right now in blue. So again, the mylohyoid has its origin on the mandible, which you can see here. Here's the mandible. And it inserts on the hyoid bone, which you can see here. Its action is to elevate the hyoid. Our next muscle is the thyrohyoid. And like all of the other muscles I just addressed for the muscles of the neck, their names have their origin always listed first and then the insertion. Thyrohyoid. It's going to have its origin on the thyroid cartilage, which again you can see here. And here is the thyrohyoid. It has its origin on the thyroid cartilage, which I just said, and it inserts on the hyoid bone. Its action is to depress the hyoid and elevate the thyroid. So it's going to pull down on the hyoid bone, but elevate the thyroid cartilage. Here is another picture of the thyrohyoid shown here. There you go. And just to review, here's our sternocleidomastoid muscle. Here is our sternohyoid. And I'll use a different color to show you the sternothyroid, just the little piece of it that's sticking out. And also in green, here are those horizontal fibers of the mylohyoid. Again, all of those muscles named for their origin and insertions. How convenient. That's two things you don't have to memorize for all of those muscles. So moving on to the digastric. Digastric, two, gastric bellies, two bellies. Here is a picture of a model showing you the two bellies. There's an anterior belly, which I'm highlighting now in green, and there's a posterior belly, which I'm highlighting now in magenta. Again, that's the digastric. The origin is the mandible and mastoid process. So mandible, one origin. Mastoid process back here is the second origin. They both insert on the hyoid bone, which is right in here. The action of the digastric muscle is to open your mouth, depressing your mandible. So if you are depressing your mandible, you're opening your mouth. The masseter. The masseter has its origin on the zygomatic arch. It inserts on the angle and ramus of the mandible. We can see a picture of the masseter right here. That is the masseter. There are other pictures where I can show you the masseter. I'm just going to jump ahead. Here is the masseter as well on this picture. Here is another model showing you the masseter. Okay. Again, the masseter, origin, zygomatic arch. Insertion is the angle and ramus of the mandible. Its action is to elevate the mandible or close the jaw. So masseter, again, origin, zygomatic arch. Insertion is the angle and ramus of the mandible, and it's going to elevate your mandible, close your jaw. So the masseter would actually be an antagonistic muscle to the digastric muscle, wouldn't it? The digastric muscle opens your mouth, depresses the mandible. The masseter has the opposing action. Now I'm going to the next muscle, the epicranius. Let me remove my highlights of the masseter. Here we go. The epicranius. The epicranius is a lot like the digastric in that it has two bellies. Here we see the frontal belly, and sometimes it's actually called the frontalis. So here's the frontal belly. And then the occipital belly, we can see in this picture here. Sometimes it's called the occipitalis. So the frontal belly, when you contract that muscle, raises your eyebrows. Go ahead and try that right now. As you raise your eyebrows up and down, do you feel the back of your head also moving, your scalp at the back of your head? That's because as you move the frontal belly to raise your eyebrows, the occipitalis or occipital belly pulls the scalp posteriorly. The two muscles are connected by an aponeurosis, the galea aponeurotica. It sounds like a bad Madonna song, doesn't it? But it is a flat tendon, aponeurosis. Specifically, the galea aponeurotica. Okay, our next muscle is our temporalis. The temporalis, all we ask you to know is the action. It elevates and retracts your mandible. It's also going to help to close your jaw. What was another muscle that you just heard that will lead to closing your jaw? Do you remember it's the masseter? So here is our temporalis. It elevates and retracts your mandible. I am sure you have had a sore temporalis before if you've ever chewed gum. Have you ever chewed stale gum and the next day the side of your head hurt and you're probably wondering why? And that's because the temporalis is so important for elevating and retracting the mandible. Our next muscle is the Orbicularis Oculi. Again, this is a muscle where we only ask you to know its action. It closes your eye, as in winking. Orbicularis Oculi is named for two reasons. It's named for the circular structure of its muscle fibers and fascicles, and also because it's around your eye. So Orbicularis Oculi would be this muscle, and you can see all of its fascicles arranged in a circular fashion. Again, important for closing your eye, like in winking. Here's another picture of the Orbicularis Oculi. Right there. Next muscle, Orbicularis Oris. Again named for the circular arrangement of the muscle fibers and fascicles, and oris part describing that it's a muscle around your mouth. I'm highlighting it now. So that's the Orbicularis Oris. Its action is to pucker your mouth, as in kissing. Moving on to the Zygomaticus. There's actually a Zygomaticus major and minor. And if your professor wants you to know that, you should ask your professor. Most of the professors teaching at Saddleback only ask you to identify the muscle as Zygomaticus. Just in case your professor wants you to know both, here is the minor and major Zygomaticus. We only ask you to know the action of these muscles. They raise the corners of your mouth, as in smiling. So again, here is the major and minor Zygomaticus. Some people have a split in the Zygomaticus insertion, which is around the corners of your mouth. And when that happens and you smile, that explains why you have dimples. In old folklore, dimples were thought to be a sign of royalty. So again, Zygomaticus, raising the corners of your mouth, like when you smile. Our next muscle is the Risorius. The Risorius is this tiny little muscle here, and I'm highlighting it. The Risorius is going to pull on the corner of your mouth. It's going to pull it back. And again, you are going to have the action as if you're smiling. You can't even say the name Risorius without it pulling on your mouth to actually speak the word. Our next muscle is the Buccinator. The Buccinator. To me, it sounds like it's a really bad throwback to the Terminator. I'm the Buccinator. I'll be back. So here's the Buccinator. It's deep. You're noticing here that the mandible has been cut away. And you can see a portion of the parotid duct actually going through the Buccinator. This is yet again another muscle where we ask you to know its action. It compresses the cheek, like in a sucking action. And this model also shows us, just to highlight some of the other muscles, we can see the Orbicularis Oculi here. I can see the frontal belly of the Epicranius here that I've just highlighted in blue. I can see the Temporalis that I'm also highlighting in blue. I can see the Orbicularis Oris that I'm highlighting in green. I can also see a little piece of the Zygomaticus muscles over here. So it just occurred to me that maybe I wasn't clear, but I'm just going to go back to the Zygomaticus in case your professor wants you to know. The major is the one that is inferior, and the minor is the one that is superior. Sorry if I was not clear with that. Now we're moving on to the levator labii superioris. Its name tells you what it's going to do. It's going to raise your upper lip, as in snarling, or as I like to call it, my Elvis muscle. Hey, baby. But here's your levator labii superioris that I'm highlighting in green. It is, again, a muscle that's going to be found deep. It's partially occluded by the Zygomaticus minor and major, and also the Orbicularis Oculi, which is why you're seeing deeper muscles on the right side of this model and more superficial on the left side. Now, that's right side for you, left side for you. So right side deeper, left side superficial. But if this were actually a human patient, of course, it would be their right and their left. We remember the anatomical position. So this would be the right side of the person's head and left. All right. So again, the levator labii superioris is going to raise your upper lip. We're now moving on to the muscles of the eye. Excuse me. Be careful with these. Some of these sound dangerously close to those abdominal muscles. And some of these muscles, as I go through them, are going to have a primary and a secondary action, and you should know both. Some of these muscles will only have one primary action. So our first one is the superior rectus. Rectus means straight. And we can see on this eye model here, the superior rectus. I actually have a video where I go through the eye model and tell you about these muscles. It is probably found under Anatomy Lab Unit 3 hit list. So the superior rectus is one of those muscles that has a primary and a secondary action. It is going to elevate and adduct, ADD, the eyeball. So you use this muscle to look up, but also when you look up and then you try and look at your nose at the same time. Our next muscle is the inferior rectus. It's very difficult to see on the eye model, which is shown here from our school. You can only see a portion of it. Again, rectus means straight. And here it is down here. Here we see the superior rectus. Now, some of you might need to know the innervation of these muscles, especially for your nervous system lecture. If that is the case, I always remember SO4, LR3, LR6, I don't know why I said that, everything else is 3, meaning the superior oblique is innervated by cranial nerve 4. And the lateral rectus, which I'm going to show you in just a moment, is innervated by cranial nerve number 6. All the other 4 extrinsic eye muscles that I am telling you about right now would be innervated by cranial nerve 3, called the oculomotor nerve. Again, some of you might need to know the innervation of these 6 muscles. Let me put that back in correctly. SO4, LR6, everything else is 3. The cranial nerve number 4 that innervates the superior oblique is called the trochlear nerve. And you will see in just a moment that the superior oblique actually takes a strange approach when it inserts on the sclera of the eyeball. It kind of makes a 90-degree bend almost. And there's a tiny little ligament that allows it to do this. And that tiny little ligament is called the trochlea. So that's why cranial nerve 4 is called the trochlear nerve. LR6, lateral rectus. The lateral rectus only has one primary function. It is going to abduct at ABD, take away, move your eyeball away from the midline of the body. So if you were to look sideways, you would be using your lateral rectus on one eye. And cranial nerve 6 is called the abducens nerve. All the other 4 eye muscles that I am showing you would be innervated by the oculomotor nerve, cranial nerve number 3. So that means the superior rectus, the inferior rectus, the medial rectus, and the inferior oblique. Those 4 would be innervated by cranial nerve number 3. Again, your professor might want you to know the innervations for a future exam. I'm just going over them in case you need to know them. Going back to our muscles again, I just did the superior rectus. It's going to elevate and adduct your eyeball. I went over the inferior rectus, which is difficult to see on these eye models, and it is going to have the action of depressing and adducting your eyeball. Here's a better look at the inferior rectus. You can see that the lateral rectus has been cut away so we can see it better. Here is your lateral rectus. So you can see the line here where we can remove it. So here is now that lateral rectus. You can see we've removed a portion of it to see the inferior rectus a little bit more clearly. The next muscle I'm going to tell you about is the medial rectus. Again, the inferior rectus, before we move on, depresses and adducts your eyeball. The medial rectus is, again, a little challenging to see because of this eye model being in place. But here it is on the medial side of the orbit. I've just highlighted it, the medial rectus. If I go back to the previous slide, I can see a better portion of the medial rectus because the obstructing muscles have been removed. What muscles have been removed so I can see the medial rectus even better? The superior rectus and lateral rectus. So again, here it is, medial rectus, right here. And its action is to adduct the eyeball. Now the lateral rectus, which I've pointed out on a few slides already, especially when we removed it so we can see the inferior rectus and medial rectus a little bit better. The lateral rectus is going to abduct your eyeball. Superior oblique. Let me highlight it. First, actually, let me highlight that little ligament that I told you about called the trochlea. And you can see it kind of creates a noose around the superior oblique, which I will now highlight in blue. Here's one portion of it, and I said earlier that it almost takes a 90-degree turn. And that's because it loops through It's a little ligament called the trochlea. The superior oblique is going to depress and abduct the eyeball. Here it is again. You can see the superior oblique in this model, and it's going through the trochlea and taking that hairpin turn. And now, lastly, the inferior oblique, which, oops, I don't have a picture. Hold on. So the inferior oblique, we only see a portion of it down here. And the inferior oblique is going to elevate and abduct the eyeball. Elevate and abduct. All right, that concludes our muscles of the head, neck, and eye.